Presentation on Tourette Syndrome. Tourette syndrome is a disorder deriving from the nervous system and is diagnosed by a doctor or other healthcare professional. It causes people and children to have tics, which are sudden twitches, movements, or sounds that are done repeatedly and are hard to control. The tics typically emerge between the ages of 2 and 15, with the average being around 6 years old. There is currently no cure, however, different treatments are available. Tics are the hallmark sign of Tourette syndrome. They are uncontrolled, repetitive, brief movements or unwanted sounds. Tics can vary in type, frequency, and severity, and can sometimes be self-injurious and debilitating. They occur for reasons unknown, but can also be in response to internal and external factors like stress, anxiety, and illness. You'll see different examples listed of simple versus complex tics. However, tics tend to increase in frequency and severity between the ages of 8 and 12. Most people show noticeable improvement in late adolescence, with some becoming tic-free, although a minority of people with Tourette syndrome continue to have persistent and severe tics into adulthood. The exact cause of Tourette syndrome remains unknown, but it is a complex neurodevelopmental disorder that is likely caused by a combination of genetic and environmental factors. Current research is continuing and points to abnormalities in the brain. The CDC estimates that 1 of every 162 children have Tourette syndrome, and it can affect all races and ethnicities. 37% are reported to have moderate to severe forms of the disorder. It is 3 to 5 times more likely to be seen in boys versus girls. It is also twice as likely to see Tourette syndrome in adolescents versus young children. And 83% of children have also been diagnosed with one additional mental, behavioral, or developmental disorder. These other disorders can include attention deficit and hyperactivity disorder, anxiety problems, learning disabilities, autism spectrum disorder, developmental delays, speech or language problems, depression, intellectual disabilities, and obsessive compulsive behaviors. As you can see, tics are just the tip of the iceberg. Tourette syndrome's impact on early language and communication includes the following. Children often have problems with pragmatics and social skills, as they may not have appropriate eye contact, adhere to personal space, have trouble remaining on topic, taking turns, and building successful relationships in school and beyond. They can improve their executive functioning skills like working memory and attention, and learn strategies to compensate for their problems with planning and organizational issues. Children can have spoken and written language difficulties like understanding and learning new vocabulary, word structure, grammar, and relationships. They may struggle understanding questions, following directions, and processing the information they hear. Children can also have speech difficulties, including stuttering and articulation issues due to an increase of stress and anxiety. There are many services that can work together to treat Tourette syndrome. Speech-language pathologists are able to treat symptoms that interfere and affect with the child's communication skills. Occupational therapists can work on the child's sensory integration and fine motor skills to improve activities of daily living. Physical therapists are able to promote and restore physical function of gross motor skills. Educators, including teachers, assistants, and anyone on the special education team, can work with the student and support them, as Tourette syndrome typically emerges and peaks during the school age years. Currently, a child can also work with counselors, psychologists, psychiatrists, and social workers who are trained in specific procedures such as comprehensive behavioral intervention for tics or habit reversal therapy. Tics can also be managed by pharmaceuticals under guidance from their physician. It is important to understand that the only consistent thing about Tourette syndrome is that it is inconsistent. So it is imperative for professionals to be prepared and be aware of the child's comfort levels and accommodations that may be in place in order to preserve their self-esteem and have a positive treatment session.